Bonjour, bienvenue. À mon tour, c'est de vous souhaiter la bienvenue à Vancouver. Alors, c'est un plaisir et un honneur pour moi que de présenter notre conférencier de ce matin, un Canadien dynamique qui se consacre à la promotion de la santé et de la qualité de vie des Premières Nations de notre pays. Et c'est un travail qui est également prioritaire pour notre collège. National Chief Sean A. Inchot Altleo is a hereditary chief from a house at First Nation. In July 2012, he was elected for a second consecutive three-year mandate as National Chief of the Assembly of First Nations. Le chef national Altleo et le comité exécutif de l'Assemblée des Premières Nations propose un plan d'action et d'engagement audacieux avec tous les secteurs de la société canadienne, basé sur une vision axée sur le soutien et la réussite de chaque Première Nation en fonction des droits et des responsabilités. First Nations across Canada supported Chief Altleo in confirming education as a top priority for the Assembly. Since then, he has been a tireless advocate for First Nations by spending time in First Nation communities across Canada with federal, provincial, and territorial leaders and with national and international audiences. In recognition of his outstanding dedication to enhancing health outcomes for First Nations people, I am very pleased to announce that Chief Altleo is this year's recipient of the CFPC Scotiabank Family Medicine Lectureship Award. Appuyé par la Fondation pour la recherche et l'éducation du Collège des médecins de famille du Canada et par la Banque Scotia, ce prestigieux prix est présenté à une personne exceptionnelle qui, au Canada ou sur la scène internationale, a contribué de façon significative à la santé et au bien-être des populations ici et ailleurs dans le monde. Please join me in welcoming Chief Sean A. Inchot Altleo.
Merci, Madame Présidente. Je m'excuse, je parle et comprends le français un petit peu. True, na ta'atlich, Chani Tlakshet. Is Elder Point still here? Elder Point has left the building after telling you to have fun. An encouragement that this group does not need. In my language, atak shitsi hathatwe hexu, musquium, squamish, tseowatooth, machanopsic, matikitsu. In Elder Point's language, of which of course you can hear he speaks a different language than I. There are 52 different indigenous languages across the country, but one word he did say is haichka. And so perhaps you can join me in thanking the Coast Salish people for welcoming us and for Elder Point for that wonderful opening. Say the word haichka with me, haichka. We say haichka as a way to not only give gratitude and expressions of thanks, but as it pertains to your work as a family of physicians serving families in healthcare. We begin with the ancient protocols of mutual recognition, of mutual respect, and of honoring that we're here in somebody else's territories and somebody else's protocols and laws and ways of being are present. And for myself, I am coming from the village of Ahousaht, wonderful pronunciation with the name of my community. Ahousaht is a little fishing village off the west coast of Vancouver Island, as far west as you can go on the continent. Next stop, Japan. If you know where Tofino is, it's about 40 minutes by boat northwest of Tofino, some of the best surfing and fishing grounds to be had. I also come from the house of Tlakishbeet and carry the name A Inchut. A Inchut is the fifth name that I've held growing up, and it means everyone depends on you. No pressure. In our culture on the West Coast, I think similar to elder points, we're given names as we move through stages of life. And it anchors you in who you are and where you come from. It's a situatedness and it's a sense of belonging, is what it's about. So I wanted to begin this way. Delegates, to the President, as well as the CEO, Dr. Lemire, along with your colleagues, as well as expressing appreciation for the support of Scotiabank from Ms. Alibi, whom I just had the pleasure of meeting, and she was telling me about the socializing going on here. Reducing the sense of isolation, I mean, right? Getting rid of that sense of loneliness, which is a big impediment to good health, we know. And also, I know that Dr. Tellier was saying he didn't need acknowledgement, but I think your organizers are doing a wonderful job. And at the very least, they're entertaining, are they not? They're helping you out. I'm very honored to be here today to accept this 2013 College of Family Physicians of Canada Scotiabank Family Medicine Lectureship Award from your esteemed organization. I want to thank you on behalf of myself and my family, but equally important, I want to thank you for recognizing and acknowledging the importance of First Nations health and well-being. As many of you know, First Nations have a holistic understanding or viewpoint of health, and Elder Point gave expression to that, about being one. I don't know how it's said in his language, Umatukwitasnish Hishuknish Tsawak in my language. Tsawak is our word for number one, or oneness, or wholeness. That which Shane was articulating, that we are all connected, that we are inextricably linked as living beings, and that all things are living must be respected and are connected. It's exciting to see the transformative shifts in health, seeing mainstream healthcare systems adopting this holistic understanding, and I thank you for this opportunity to share more about First Nations' vision of health and wellness and about notions of interconnectedness. The Assembly of First Nations, which I have the great privilege of leading, puts health and well-being of our people at the center of our work. We understand the critical importance of ensuring the physical health, but we also work to build healthy communities, strong governments and strong nations working to overcome the sense of isolation and disconnection that happened over 7 generations of residential schools where, in the sense of family, youngsters were pulled from the grips of those loving families and identity for generations. I'm also happy to report I think we have over 300 First Nations physicians across the country as of today. And I know there's the niece of a good friend of mine. I don't know if she's here, Sarah Bracupe, Dr. Bracupe. Are you in the house? Beansy, stand up and be acknowledged. Oh my goodness, I'm in trouble now. That's her nickname. Hi, happy to be here with you. In all of our respective territories, we have, as you do as well, Sarah, coming from such a strong lineage that I know you do come from, we have deep teachings that are the likes of which Shane and I are sharing, that of interconnectedness, of oneness. We mention this not only in the context of health, but also the notion of relationships more broadly, bringing forward the importance of recognizing the social determinants of health, housing, children and families, education, economic opportunity and development. My goal this morning with you is to share our health story and to speak to the healthcare system and delivery of health services from a First Nations perspective. And through this lens, hope to make clear that working together collaboratively and in partnership, we're able to bring together traditional and cultural practices with Western-based approaches that will create optimum healthcare for First Nations and enhance healthcare for all. It will also strengthen the relationship and build understanding between all our people, something that I feel strongly is needed, especially at this moment in history. Overall, health outcomes of First Nations, as you well know, lag far behind the non-Aboriginal population. It's been a long goal of the Assembly of First Nations to close the gap in health outcomes between the general Canadian population and First Nations. And I wish to anchor this notion as well at the context of this relationship historically. Last month, October 2013, marked the 250th anniversary of the Royal Proclamation. The Royal Proclamation of 1763 that went on to be manifested in treaties, then brought forward in the Constitution Acts of 1867 and 1982, and then once more in the more recently adopted United Nations Declaration on the Rights of Indigenous Peoples. Healthcare for First Nations continues to be a complex and diverse issue, but we're still building on these expressions of recognition going back 250 years that First Nations have the rights to self-determination, the rights to their land, the rights to share in the economy of the land. That was further articulated in the instruments such as the treaties and the Constitution and the United Nations Declaration. The UN Declaration, in fact, brings forward a sentiment that in the treaties, in Treaty Number 6, for example, across the prairies where I was just in the last few days, the treaty right to health is explicitly articulated. It has been a challenge for Canada and First Nations to determine how to give effect to that treaty right to health. And so in a modern context then, we look to the UN Declaration for guidance. First Nations view that, and I would encourage you to take a look at this declaration. It's considered by Indigenous peoples, not just in this country, but around the world, to be the minimum acceptable standard globally. And it expressly says in the UN Declaration that Canada is a successor state, having the responsibility to bring forward the sentiments that are expressed in the Royal Proclamation from 250 years ago, as well as subsequent treaties, including explicit references to the treaty right to health, that we must design these approaches together. And this is a constitutional obligation as well. We know that our on-reserve federal health programs and services are not well coordinated, that there are major funding gaps within the different funding components. The federal model for delivering health has created siloed approaches to the funding, making flexibility and adaptability to emerging issues near impossible. And while we continue to work with our federal partners at Health Canada, First Nations people continue to suffer disproportionately with poor health, both mentally and physically. In fact, it has become our shameful reality that simply being Aboriginal is a health determinant at this stage in Canada. We also know that provinces and territories play a huge role in the health of our people, living both on and off reserve as they access and depend on these health services daily. We must then find creative and innovative ways to work together to move beyond jurisdictional divides. The very health of our people depends on this. Many individuals, families, and communities face significant mental wellness challenges stemming from oppression, colonization, and the intergenerational legacy of the Indian residential school system. We have thankfully growing awareness of this because of the important work of the Truth and Reconciliation Commission that perhaps you've now become aware of. And just months ago, right here in downtown Vancouver, I was so honored to be marching with 75,000 citizens of British Columbia who were marching to support Indian residential school survivors. It was a powerful moment in the history of this province and this country to see that happen, that depth of acknowledgement. It is well known that people suffering from addictions or mental health issues are more likely to find themselves involved in provincial or territorial justice systems. And although suicide rates vary considerably between First Nations communities, the First Nations youth suicide rate, and youth form the vast majority of our community right now, over half being under the age of 25, that the suicide rate is approximately 5 to 7 times higher than that of the Canadian general youth population. And you will not find the word suicide, that sense of deep isolation and loneliness, in our language where I come from. No such oral history exists. It's a modern phenomenon. We went through a crisis in my own village of Ahousaht that those in BC may recall back in 2005, where we had over 60 attempts and several completions. And my community asked me to reach out to express the sentiment up high stuff, that to be friendly, that when you're in a moment of need, that you ask for help, and we did. And I can stand here and gratefully say support occurred. Just like Elder Point said, that being together is medicine. People came, and it was good medicine, just to be seen for being in a moment of trauma. And initiatives flowed from that I can say that the health and well-being of my own community has greatly improved even since that crisis moment in 2005. Our leaders and citizens right now, coast to coast to coast, are making a collective call for a coordinated and comprehensive approach to health programming that is respectful, that's inclusive, and that's grounded in our culture. We must work together with our federal and provincial partners and other healthcare stakeholders. This is extremely important at a moment leading to the 2014 Health Care Accord talks that will take place between the federal government and the provinces and the territories, that the First Nations voice is absolutely critical. Examples that exist, like right here in British Columbia last month in October, after a long period of effort, a historic transfer of all federal health programs and services to the control of First Nations took place. The establishment of Canada's first provincial First Nations Health Authority was a key component of the tripartite First Nations Health Plan that was signed in 2007, which was mandated by all 203 First Nations here in British Columbia. That's an incredible feat. We're talking over 30 different First Nations languages here, all around the province of BC, but they came together on this topic of health. BC First Nations supported the establishment of this authority as it will incorporate First Nations cultural knowledge. The notion that that chant that was done by Elder Point would be done and taught to children on the shores of rivers and streams and ocean fronts and deep in the bush, really reflecting core identity and cultural expression that really is an element as well of good health. To do this work, it's important to understand how these elements of culture and viewing health through a cultural lens assists in healing and in prevention. Understanding how we effectively design, deliver, and maintain culturally based programs requires clear and considered plans that are supported with appropriate policies, protocols, and client engagement strategies. This requires the translation of worldviews. It requires a conversation of culture that we're not necessarily accustomed to. So if we look at healing from an Indigenous cultural lens, we must recognize that healing is much broader than treating illness. In the context of intergenerational trauma, it requires a different approach. And we must recognize that a focus on the individual does not reflect the values of Indigenous people, which incorporate family and community. If we look at addictions and aftercare, it's not a matter of providing care for the individual. We must treat the family and the community because of their role and connectedness to the individual, and overcome that sense of finger-pointing and blaming that was best characterized by friend and mentor, perhaps you know of Grand Chief Stephen Point, the former Lieutenant Governor of British Columbia, who said, importantly recently, as a respected judge, that the experience of Indigenous peoples in this country is like the breaking of the leg of a man one day and then blaming him for limping the next. He was saying something that was coming from a place of moral leadership as a senior elder within our nations, helping us younger people within our communities to better understand our situatedness within this conversation and within this work. One example of a strategy that reflects the understanding of work through an Indigenous cultural lens is that of the National Native Alcohol and Drug Abuse Renewal Framework. In 2007, as a response to overwhelming need expressed by communities, our organization, the Assembly of First Nations, along with the National Native Addiction Partnership Foundation and the First Nations and Inuit Health Branch of Health Canada, oversaw a comprehensive, community-driven review of substance use-related services and supports for First Nations people. From 2007 to 2011, the review included a wide range of knowledge gathering and consensus building activities, including regional needs assessments, a national forum, research papers, regional workshops, and an Indigenous knowledge forum. These activities directly engaged, and this is an important aspect, everyone involved in this work: community members, treatment center workers, First Nations leadership, elders, the likes of Mr. Point, health administrators, researchers, policymakers, all with the aim of developing and shaping a renewed approach for community, regional, and national responses to substance abuse issues among First Nations in Canada. The results of this process and engagement were set out in the report called Honoring Our Strengths, a renewed framework to address substance abuse issues among First Nations people in Canada. It outlines a continuum of care in order to support strengthened community, regional, and national responses to substance abuse. The vision is intended to guide the delivery, design, and coordination of services at all levels of the program. This approach recognizes that responsibility for a strengthened system of care includes individual responsibility for managing one's own health, communal responsibility amongst First Nations people, and a systems-wide responsibility that rests with individuals, organizations, government departments, and other partners. It includes this notion of self-responsibility that we as well, the leadership and the chiefs from across the country. In BC, I don't know if I'm going to get in trouble for projecting this, but I think the chiefs undertook the Chunky Chiefs Challenge. It was about taking responsibility for their own health. And those are somebody else's words, by the way. Those are not my words. These are the people that elect me, right? Don't forget that. I'm responsible for serving them. Or at the national level, the Indigenous Action, where we've incorporated health activities and wellness, reaching out to supporters and funders outside of mainstream systems like Nike 7. They've got an Indigenous arm now at Nike. Or Tim Hortons, and yes, they bring donuts to these events. It seems counterintuitive here. Or the Rick Hansen Foundation and Just Move It. In 2012, the Assembly of First Nations report released the findings of 3 national roundtable sessions identifying current best practice in Indigenous sport and wellness and areas that require improvement. And as a former soccer player and baseball player, as one who used the services of the Friendship Center in East Van as a kid that kept me out of trouble and out of the wrong side of the law, which right now in parts of Canada, we have higher incarceration rates amongst our young people than we do graduation rates. We require a significant transformative and bold move to support especially Indigenous young people, and sports is one I think really important element here. So as I talk on a number of these aspects, perhaps the question begins to arise, where do family physicians fit into all of this work? In many instances, you work directly with the individuals and the families, First Nations, whether it's in our communities or in city centers or rural locations. We need to be mindful of realities that may not be readily apparent to those unfamiliar with our peoples and communities. For example, it's been reported by First Nations community health directors that First Nations people are reluctant to ask questions and share a partnership role in their own health care because of the effects of colonization. This includes the perception of physician and healthcare providers as the authority, and the challenges in translation across First Nations, including English, French. We've got 53 languages, and if I go to northern Quebec, the first language is Innu. And if the people there speak a second language, it will be French. And of course, the similar examples would occur in the rest of the country. Given this legacy of colonization, we then look to a process of decolonization, emerging as a priority for our communities, for our families, and for our nations. First Nations health is widely understood to also be affected by a range of historical and culturally specific factors. And these are sometimes referred to as First Nations or as Aboriginal specific determinants of health. These include loss of language. We're placing heavy emphasis on this, given that in the memory of my own father, he watched as a 6-year-old would have their tongue pricked by those in the residential school as they attempted to speak the only language that they came there knowing. The connection to the land, colonization generally, residential school abuses, specifically systemic racism, environmental destruction, cultural, spiritual, emotional, and mental disconnectedness. The differences in culture and histories that are associated with the effects of trauma and ways of healing go beyond the individual and family to include community, and beyond the individual's past to include the historical past. And so, yes, there is an absolute specific role for family physicians and practices, but as a family of physicians nationally, we're reaching out for this to be a true partnership to overcome the pattern that Justice Murray Sinclair, who chairs the Truth and Reconciliation Commission, talks about. This is about trauma that's been feeding trauma for a long time. Although pain might be observed as physical, there can be psychological and social factors that impact or intensify the physical pain. Therefore, treatments through pharmacy might not be the best or only option for pain management. Culturally specific interventions are holistic, meaning that they do not attend separately, to the mind or brain and the physical or emotional parts of the body. Instead, they attend to the mind, the body, the spirit, and the emotions all at once, having experienced being surrounded by elders in the bush in my own home where medicinal trees are used, and you can feel the impacts of that intervention. That's about a chant like that. It's about going into the river after your skin's been exposed to the healing properties of trees that have been used for millennia in our home territories. So this is about addressing the harms of intergenerational trauma, harms like addictions, reconnecting to cultural identity, obtaining a spirit name. Inchat, although it feels like a heavy burden, is more importantly an anchor to a history. It's an anchor to a sense of belonging, and as importantly, it pushes you. The elders will provide a name because they see something in you. They provide you with that name to push you in life towards success. Using natural medicines for prayer, cleansing, and detoxification, holding ceremonies that attend to pain, grief, or loss. I am very pleased to see that the College of Family Physicians of Canada is incorporating some of this understanding into your current work. Reminded here this morning that Goal 6 of your strategic plan focuses on social accountability and equity, and that includes enhancing the organizational awareness of the impacts of social determinants of health on the health and well-being of people in Canada. Heichka for that recognition. I see this objective directly impacting the work that I've just spoken of, as well as future discussions between the college, family physicians, and First Nations. It's also my understanding that the college has developed an Aboriginal Health Working Group and a Social Accountability Working Group with a purpose of partnering with Aboriginal communities and organizations and to enhance the health, well-being, and access to quality health care of Aboriginal peoples by supporting education and advocacy of family physicians in Canada. Heichka for that important leadership. This includes supporting and sustaining an appropriate increase in the number of practicing Aboriginal family physicians in Canada. I like that one. And advocating for support to accessible, relevant, and high-quality health care for Aboriginal communities. I commend you for these important commitments. It's these innovative approaches and the willingness to work in partnership that will transform our health systems and lead to healthy, vibrant communities and families. The Assembly of First Nations looks forward to hearing about the great work coming out of the College of Family Physicians of Canada and supporting you as you continue to work together with First Nations communities and organizations to carry out this important work. The First Nations vision is to have First Nations controlled and sustainable health systems that adopt holistic, tsawak-ish, comprehensive and culturally appropriate approach to health service delivery, and to find ways to integrate with other health services, where First Nations have the ability to design and deliver programs and services that meet the needs of their community and their nation. This vision includes access, services, and benefits to all First Nations people, regardless of where they live. It's the goal of all of us who are working to address First Nations health, that communities will regain and improve their wellness and individuals will lead healthy and empowered lives. For our part, First Nations will work towards developing federal, provincial, and territorial partnership agreements, the likes of which was just executed here in British Columbia. A new relationship and ways of working together must be found. These agreements must be based on a shared commitment to improve First Nations health and responding to First Nations health disparities. We look forward to important groups like the College of Family Physicians of Canada to ensure that health equity remains a top priority, that it's based on improved access, adhering to a vision of health as part of a seamless continuum of care, and improving First Nations control over health care. I commend all of you here today for the visionary work that you do and your many, many accomplishments. Working together with your support and partnerships, we can achieve a historic moment when long-standing health inequalities between First Nations and Canadians are eliminated. We can lead our youth to successful careers in the health field, careers that are fulfilling and that enable them to provide for themselves, their families, and their communities. We can raise our people in a life free of poverty and full of opportunity where we all enjoy safe and healthy communities. I thank you, Heichka Kleko, once again for the opportunity to speak to you this morning. I want to convey my sincere honor and all humility in this award. Your continued commitment to First Nations health and wellness can and will help us move forward together towards a new era of reconciliation where our people stand strong alongside one another as true partners. A tomorrow that echoes back to the early days together in our original relationship of respect, recognition, and sharing. Healthy communities, healthy families, healthy children creates a better tomorrow for everyone. Hajka, tlek go. Thank you.
Thank you. Yes, thank you so much, Chief Atleo, for your inspiring presentation. And as you said, and you know, the CFPC is committed really to enhancing the health outcomes of First Nations and communities. And I just want to tell you that the college, and certainly all family physicians in Canada, embrace your vision, your aspirations, and your goals, and we really want to make a difference. So this is why it is so important for us at this time that you gave us the opportunity to learn more about your tremendous work in this area, and we will continue to be inspired by you. We commend you on your dedication that is sure to make a positive difference to the quality of life of many people in Canada. J'aimerais maintenant demander à Madame Nalusha Alibay, au Dr Ralph Massey et à la Dr Francine Lemire de présenter le prix de la conférence en médecine familiale CMFC Banque Scotia au Chief Atleo.
So when the decision was made to ask Chief Atleo to speak this morning, I indicated to our staff, well, you know, this man probably doesn't know much about the college. I'm prepared to have a chat with him. Our Director of Government Relations, Health Policy could speak with him, and I was told in no uncertain terms that, in fact, Chief Atleo did not need any conversations. That he was his own man, he had something to say, and that he would find out about the college and be able to integrate all of these important concepts. And I'm very reassured, and I want to join to the others who've spoken in thanking you for this address. So now we are moving to the part of the program during which we want to recognize